Hello everyone, this is Dr. J from LifeSpine Health Enhancement Center. I'd like to share with you an important condition this week, and it revolves around the SacroIliac joint. And this joint is a common pain generator for many people, but since its close proximity to the low back and the lumbar spine, people often confuse it with being a low back problem, which semantically could be the case, but nonetheless, proper identification of this joint is necessary so that you can receive the proper treatment. Now, to show you what the SacroIliac looks like, I will recruit the help of my friend here. And this is a model of the spine and pelvis viewed from the back side. So you're actually looking at the back part of the low back and the sacrum and the pelvis. Now, it gets its fancy name of the SacroIliac joint because of the two bones that form that particular joint. At the base of the spine, you have a triangle-shaped bone, the tailbone, or called the sacrum, and it articulates with the pelvic bone called the ilium, and that forms the SacroIliac joint. It's the two knobs or little dimples that many people have at the base of their spine near their low back, and it's easily felt by just simply feeling for those two prominent bones at the base of the spine. Now, one common thing that happens when the SacroIliac joint is restricted or not moving properly, one, all the muscles that attach to it, like the glutes, the piriformis deep into the pelvis underneath the gluteal muscles, and all the muscles that attach the low back to the pelvis, when the pelvis gets rotated out of position and out of alignment, it can cause a lot of muscular strain. And that's commonly what brings people into my office, is the muscular pain caused by a bone out of alignment. So you could rub those muscles and stretch them and massage them and strengthen them, but if you do not address the underlying structural problem in joint restriction, those sore muscles will always return time and time again. So the best form of treatment is to identify if that joint needs to be moved, move it, and then introduce the soft tissue therapy and physical therapy that's going to strengthen and support that positive structural change. One big thing that can also happen from a SacroIliac dysfunction is when we walk, our pelvic bones move somewhat freely from one another. So this one's going to rock forward and backwards as we stride. What can happen is that joint can become stuck in a backwards position. That causes a chain of reactions, the chain of events that actually shortens one leg on one side. So if you're under the suspicion that perhaps you have a leg that's shorter than the other one, or it looks like you're standing crooked, the problem could also be coming from that SacroIliac joint. And the best way to have it treated is to be, one, evaluated by a chiropractor, and secondly, have the treatment that is required to mobilize that joint, restore it to its proper position, and that will create a level foundation between your two pelvic bones rather than having one side shorter than the other. Because if that's left untreated over time, that joint restriction will not only cause local pain to the low back and near the backside glute muscles, but over time, those bones of your spine are going to start to lean towards that lower side, and they're going to be forced to have to curve to compensate for that change. And some abnormal curvatures or scoliotic curvatures can develop simply due to having an unlevel foundation that could be caused from a SacroIliac joint restriction. So, I know that was a lot to digest, but if you'd like to learn more, we have a blog post posted on our website, www.lifespinecenter.com. You can follow the links provided and learn more about the SacroIliac joint. A common population that is affected by this disorder are pregnant women. Having that extra load in the front part of the body causes the back to hyperextend, or it can cause hyperlordosis of the low back and also cause compression of those SacroIliac joints. And that's why a common symptom for pregnant ladies is to have low back discomfort. And chiropractic care is a safe and effective way to care for pregnant women all the way up through the third trimester up until the delivery process. So keep that in mind. Thanks for watching this video. Please, I encourage you to follow our YouTube links and learn more about chiropractic conditions and how chiropractic can be a powerful tool in your healthcare. And if anyone is watching within the St. Louis area, we are located in Swansea, Illinois, in the Benchmark Plaza. And more of our information can be found on our website. So please follow the links. Thanks for watching, and we'll talk to you soon.